Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us. Good morning. It's Tuesday, June 30th. It's been a couple weeks since here at Wild Health we gave you a podcast. The last podcast that we did, we talked about the negativity and how we really wanted to be more positive in future podcasts. That's why it's taken us a little while. So today, it's all positive news, right, Mike?
Yeah. I feel like we probably would just never give you another COVID update if it was just going to be positivity, unfortunately.
Yeah, so things are not great, but we're going to report on it. We're going to talk about it a little bit, and then we're just going to talk about some things we can do because we want to talk to you some more. So right now, we have about 2.6 million cases in the United States and about 130,000 deaths. There's over 10 million cases and 500,000 deaths worldwide. The pandemic and the virus does not seem to be slowing down in general. It is in some places, but in most places it is not, especially if you're here in the United States. So data from the Financial Times shows that coronavirus deaths in the United States continue to increase with more than 4,500 deaths a day on average over the past week. Brazil consistently reports nearly 40,000 new cases a day and reported record-breaking new daily totals over each of the past several days. Meanwhile, India similarly reported its highest daily case count for the third day in a row. The country currently has the third highest daily incidence in the world after the United States and Brazil. Indian officials announced this week that they would be launching a massive testing effort in New Delhi, the nation's capital. They plan to survey all of the city's 29 million residents and test every individual with symptoms by July 6th. And we will come back to testing at the end of the podcast as we usually do.
That's amazing. That's going to give us some really interesting data on prevalence if they test all of 29 million residents. I can't wait to see that research. That's going to be great.
Well, specifically, they said they were going to survey all of the city's 29 million residents and test everyone with symptoms, but it'll still be a tremendous amount of data for sure.
I see. It'd be nice if they at least tested a percentage of those asymptomatic people, because that would be really helpful for true prevalence, right?
Yeah, you'd hope that maybe they could just do a sample, maybe 10,000 or 100,000 or something like that would give some real good data of asymptomatic as well, and because we've gotten really good, interesting data on that of the thousands that we've tested asymptomatic. But to be able to do it in a concerted effort like that, a much bigger group would be even better data.
Yep, for sure. So the number of new cases in the United States surged to unprecedented levels this week. Nationwide, the number of new cases has risen by 65% over the past 2 weeks, including several states that were the first to reopen. At least 7 states, including Arizona, California, and Texas, are also reporting their highest rates of hospitalizations since the beginning of the pandemic. So, Matt, that really indicates that the rise in cases cannot really just be accounted for by testing alone, which many people in our government and in the news have been suggesting. Saturday evening, we saw the nation's largest spike in cases yet, with more than 44,000 new cases confirmed by the CDC over the previous day. But, it's important to remember that the CDC reports lag behind official case counts from individual states, which themselves vastly underreport in the first place. So despite how high these numbers seem, the true prevalence is actually even higher. On Friday, the CDC released an analysis of data from 6 different regions across the country, shows the true number of cases is likely more than 10 times higher than the reported rate. Cases continue to surge across the South and West. Nevada, South Carolina, and Florida were among the states that set their own single-day records this week. Mississippi reports that many of its ICUs are at capacity, while all 4.7 million residents of Harris County, Texas, which includes Houston, are now under a level 1 severe coronavirus threat alert, which is the highest warning level. The state's hospitals are reaching capacity with 100% of ICU beds in one of its major hospital networks already filled. Once again, the rise of hospitalizations includes that the spikes in cases are not due to increased testing, but rather a true acceleration of the state's outbreak.
Yeah, and throughout this pandemic, sometimes it's been hard to really figure out what's going on just because there's so much we don't know. And if you flip back and forth between, for example, Fox News and CNN, you have no idea. The same story will be reported completely differently. And people have different opinions and different interpretations. But I think it's pretty clear at this point that this is, at least in my mind, this is much worse this summer than I expected. I was really hoping that the summer and the warm weather and everyone being outside, that we would get some relief. And what I expected was that we would get some relief over the summer, everyone would relax, and then we'd have a really bad fall and winter with flu season. That has not happened. I have been, I'll tell you, I was wrong about that, and I've been somewhat surprised at how the summer has went, and it makes me that much more nervous for the fall and the winter. But I do think it's kind of our job not just to report this, because this is all over the news everywhere anyway, but to talk a little bit about what's the solution, what can we do now? And I think people know in general, but just to reiterate, and I get nervous even talking about these things because I worry people interpret it as political, and it's not. But in my mind, and Mike, you can tell me your opinion, but in my mind, masks, there's been some good studies out recently about that. Common sense, social distancing, not having big parties, and testing. In my mind, those are the solutions. I don't know if you have other opinions about other things that are the most important. I mean, there are so many things we can do and talk about, but I feel like if we really focused on those three things, we would be a long way to just doing better.
I guess I could specifically include social distancing under common sense. But I would bring that out as well. I am very frustrated by the tendency to try to politicize some of these things. I mean, social distancing and masks and testing that's science. That's not politics. That is like, there is no role for politics in these decisions. And it drives me insane that I feel like that's where we're at right now. And that's why many other areas of this world have successfully not eradicated, but significantly reduced the impact of this virus, and why we're still struggling with it. And that's, I don't know how else to put it other than frustrating, because that is science, not politics.
Yeah, and I completely get the civil liberties things and Americans not wanting to be told what to do. But if we all just did a little more, it really goes a long way when it comes to just masks and common sense. And then testing. I was actually really encouraged last week. On Friday, the news kind of broke. The White House, Dr. Fauci was talking about pull testing, which we were really excited about. We've been talking about that and really pushing that for a while. And it seems that, if you kind of read between the lines, the FDA started to push that. Last week, the FDA came out with a frequently asked questions document. And in that document, they actually talk about pull testing. And they say, well, pull testing right now is not FDA approved, but if you want to get FDA emergency use authorization, here's how you do it. And they kind of outlined and gave a link and everything. So it was really exciting to see that. We think that, as we've been saying for quite some time, this is a needed solution. And it seems like those in government who can actually make this happen on a big scale are in agreement. So our lab is actually trying to push through with that paperwork and get FDA EUA. I assume and hope that other labs are as well, because I do think this is going to be a really big solution. Recently, though, we've come across another way to get testing done for companies. We started helping a lot of companies do screening, as we found out that pretty much all insurance and payers are paying for COVID testing, even when it's just screening. What happens is, if someone goes into a hospital, hospitals are getting paid sometimes $38,000 per patient with COVID. There's a lot of money out there for that. And so insurers and payers who have to pay that they have a real vested interest in keeping these outbreaks down and keeping people healthy. So they know that testing is part of the solution. So they're paying for screening, even if someone has no symptoms, they want to identify these asymptomatic spreaders. So we've helped several companies actually do the testing, and even though pool testing is globally a more cheaper and more efficient way to do it because you're using less resources, you can still test individually, and it can cost the individual and the company no money. The insurers are paying for that. So even if companies can't afford kind of the cash price with pool testing, it can be ran through their insurance. And normally we at Wild Health, try to stay out of the insurance world, but we do realize these are exceptional times. So what we're doing, and I'm just putting it out there if anyone's interested, if you're a company and want testing, we have an email, testing@wildhealth.com. You can email. But what we're doing for a few companies is, say they have 300 employees. We're setting up a program where we will test them once a month, once a week, once every 2 weeks, however often, just screen everyone. It's ran through their insurance. The insurance pays for that testing, so it doesn't cost the company anything. And then also another big advantage that we've kind of stumbled upon that several companies have reached out to us about is right now the situation for companies, it's not just that they want to identify these asymptomatic spreaders, but they're having a hard time running their business in some of these really necessary. There are a lot of industries that just have to keep running for the economy to go. So these essential workers, if you're in a situation where you're a factory or some other place and you can't have a large number of people out, people are still getting migraines and colds and coughs, and the current guidance is that those people have to quarantine and be away for 10 to 14 days after they're asymptomatic. And when you do that, those numbers start to really add up. So the other option is most of the public health departments are saying someone has to be off work for 10 to 14 days, or they need multiple negative COVID tests. So 2 COVID tests separated by a certain amount of time. So that is also an option for companies that we've helped with. So we do for example, screening everyone every 2 weeks, and then anytime a certain person is symptomatic, test that person really quickly. If it's negative, then we think, oh, okay, well, they have migraine headaches. This headache seems like they're migraine. That's probably it. So let's do another test. And so after doing multiple tests, then it seems, okay, that person did not have COVID. Then as soon as they're asymptomatic, they can kind of go back to work. So they can return to work. So it improves efficiency for the company, and the screening helps keep people safe. So hopefully pool testing is going to get FDA emergency use authorization, and that'll be a really great solution for labs and for companies across the United States. But until then, we just kind of want to put that protocol that we just mentioned out there. So if other labs are able to do it, great. If you're not a lab and you're a company and you want more information about how to do that, email us at testing@Wild Health, and we'll be happy to tell you how to do that either with a local lab you have in your area, or if we can help you, we'd be happy to help you as well. So,
Matt, you're kind of saying it, but I just wanted to put it into words. This is not going away. This is going to be with us through the rest of the summer, through the fall and the winter, and I guess we don't really know exactly what the fall and winter is going to look like. But the idea that you're bringing up, where people are going to be getting sick, and we're going to have to figure out whether it's COVID or not COVID, that's going to be extremely prevalent when it comes to fall and winter, when we start seeing more increase in viral illnesses other than COVID. So there's no way forward without testing. I think that's definitely clear to me now. I was a little optimistic about it previously, just like you were, regarding maybe the warmth from the summer, the extra sun will decrease things. That's proven to not be true, and I think it's going to continue to be a problem for us at least through the next year or so.
Yeah, and things are bad right now, but there's a high probability that they will be worse in the fall and the winter. And so in my mind, now is the time to come up with your protocols as well. If you're a company or just an employee and you want to tell your company, you probably need your protocols in place now for what's going to happen in the fall, winter, especially we're talking about these really essential factories and other places. If you have to be in operation, what are you going to do in the fall and winter when you've got some people with COVID, you've got other people with flus, and you have other people with rhinovirus, you have all these things going on. Now is the time to think about that. So we've been helping a lot of companies with those protocols and things. We're happy to share those protocols with anybody that wants if they email us. So Again, sorry for the delay in podcast over the last couple of weeks. We were giving you 1 or 2 a day for a long time, but I feel like we kind of disappeared on you. But it has taken an incredible amount of our time and resources we decided a month or 2 ago, how can we help? We realized it was testing, and we spent a lot of time getting to the point where we actually can do that. We have committed to being more regular with the podcast. Mike and I actually have a time set aside every week now where we're going to be recording, and we have some really cool stuff coming up, non-COVID related. We're going to be talking in the next week or so with some real experts on what is the absolute greatest water in the world. Our bodies are 2/3 water. People know that, but the size of water molecules are so small that 99% of the molecules in your body are water, and we've never really talked about that. So, Mike, you can't see me right now, but I literally have some water sitting beside me right now. I've been so kind of geeked out about this. I have a bottle that does electrolysis, and I have deuterium depleted hydrogen water sitting beside me right now that I just drank. And I have no idea, like I've been going into the science and reading studies on this and don't know how important it is. You hear some people talk about hydrogen-rich water, structured water, deuterium-depleted water, and they just say it's the panacea for everything. So I am testing them out on myself. We've got a really great podcast schedule. We're recording tomorrow with Dr. Gerald Pollack, the real structured water and exclusion zone expert. You've got a podcast set up. We're going to record with Dr. Morgan Levine on epigenetic age and some really cool stuff with that. So we promise we're going to come back to you. We're going to get into some of the really fun and cool stuff, and we'll continue to give you COVID updates, and we'll try not to be a stranger and just podcast every 2 weeks. Is that a weird way to say that?
No, I think that was appropriate. Yeah, and don't worry, the next update is going to be super positive.
I'm sure. Thanks for listening.
Thanks for listening to the Wild Health Podcast. If you found it helpful, give us a 5-star rating and write a review on iTunes. It really helps the podcast, and we greatly appreciate it. If you want to be a client or you want to work with us, go to wildhealth.com. Thanks again.